Hi guys, my name is Choi and I'm going to present about my lab project. Medical history. The patient is 36 years old, Asian female. Her blood pressure was 110/78, pulse was 88, respiration was 18. The patient has a family history which are low blood pressure and stomach cancer. She is taking birth control Abra EQ but no contraindication for dental treatment. She has no allergy. Her BMI is 18.9, which is normal. Her ASA status is 2 due to the patient is taking e-cigarette, 1 cartridge per 2 to 3 days. Periodontal assessment. Patient chip complaint was sensitivity on the upper right side when she was drinking cold water and brushed teeth. Her last dental visit was February 2021 for exam and cleaning. No patient history of periodontal surgery and SRP. The patient has a synthetic restoration in molar and premolar occlusion area, and the most of them finished in 10 years ago. Patient oral H was fair. Recession were generalized 1 millimeter in buccal and lingual aspect, no mobility, no furcation. Periodontitis AAP stage 1 grade B due to interdental car is generalized 1 to 2 millimeter. No tooth loose due to the periodontitis radiographic bone loss extended to corner. Grade B, which is moderate late due to e-cigarette smoking 1 cartridge per 2 to 3 days. Westerly calculus code 3 light medium. As you can see this radiograph, generalized horizontal bone loss, and you can see the supernumerary teeth between 12 and 13. Crown and tooth ratio was 1 to 2. EO and IO examination, extraoral, asymptomatic popping sound on the left side, intraoral gingival description, maxillary pink firm, smooth, light edged, mandibular pink firm, smooth, pigmented, lurid border. Maximum opening was 38 millimeter over by 3 millimeter over 2 millimeter. Facial profile was mesokinetic, oral heavy, nocturnal bruxism. Occlusal classification was oral class 1. Finding were faulty restoration on number 19, occlusal buccal area. Occlusal were related to bruxism, sign of attrition in canine due to the grinding. Current oral hygiene, plaque index score was 26%, noticeable supramandibular lingual calculus. Oral hygiene routine was brushed 2 times a day, use Crest fluoridated toothpaste. The patient is not using floss and fluoridated mouth rinse. Treatment plan. Due to the patient is light, 3 light medium, the treatment was proceeded with 5 appointments. First appointment was initial assessment, review medical history, take mouth X-ray, screening patient's oral condition, and get the treatment plan from the doctor and faculty. Provide OHI based on the patient need and smoking cessation information. Second appointment was focused on the instruction, find the patient's risk factor with Canberra assessment and nutrition analysis. Third and fourth were treatment appointment. Start prophylaxis divided by a right and left area each time, and after that fluoride varnished. Last appointment was a re-evaluation to check the level of improvement that has been made. For recommendation, doctor referred the patient to general dentist to get a new filling on number 19 and mouth guard for bruxism, and also referred to oral surgeon for supernumerary teeth evaluation. For recession, we put 5% sodium fluoride varnish. Through the Canberra assessment, patient has moderate to high risk factor of caries due to localized plaque calculus, snacks between meals more than 3 times, regular soda, no fluoridated water. Nutrition counseling. In 3-day carbohydrate analysis, patient was exposed 47 minutes in liquid and 240 minutes in solid carbohydrate. So recommended was reduce fat, carbohydrate, and sodium intake, increase protein, vitamin, and mineral intake, minimize snack and soda consumption, eat breakfast to prevent a big meal on the lunch and dinner. For oral hygiene instruction, we recommend brush it twice a day for 2 minutes with a modified bath technique. Use small and soft toothbrush, flush daily, interdental brush, tongue scraper, fluoride mouth rinse. Every 3 months, visit dentist for periodontal maintenance and suggest smoking cessation. Treatment progress. For nutrition part, in macronutrition, the patient reduced the fat and increased the protein intake. In micronutrition, the patient increased the mineral and vitamin intake, reduced sugar and sodium intake, increased water intake, reduced snack and drink soda. Try to eat healthy meal on the time. Exercise 3 to 4 times a day. 4 times a week. Oral hygiene. Plaque index score was decreased from 26% to 18%. MBI score was decreased from 30 to 20%. Patients start to use floss, fluoridated mouth rinse, and interdental brush. Probing depth localized improved in molar distal area aspect. Self-report patient tried to use nicotine patch to quit smoking. The patient reported that she made an appointment for number 19 filling and mouth guard, but did not make an appointment for oral surgeon because she did not feel any discomfort currently. This is her Re-evaluation assessment. Research. The oral health impact of electronic cigarette use. There are a lot of people who switch to e-cigarette because they want to quit smoking, but through the research, I found that e-cigarette can be equally damaging to oral health. E-cigarette was smoked by adding chemical spices to nicotine solution, heating it, and inhaling through the vapor. It raised the temperature in the oral cavity and make it dry. When the oral cavity is dry, it becomes a good environment for bacteria to grow, which can cause virus oral epithelial damage or infections. It can lead to gum disease and increase the risk of oral cancer. Interesting experience. Hyperdontia is a local factor. The patient has a supernumerary teeth between number 12 and number 13 root area. These teeth are erupted but might have a complication such as root resorption of neighboring tooth, rotation and deflection of the root. In some cases, cyst formation. Patient did not feel any discomfort but checked the condition regularly and referred to the oral surgeon. Self-evaluation. Through the lab project, I have learned that a patient's oral health can be improved through the proper oral education and a treatment plan. Many of the patients I saw this semester did not know what proper oral health was. As a future dental hygiene, I think this is really important to keep patient interest in oral health and help them to maintain it by explaining the importance of oral health. With good oral health, allow us to get a good nutrition and with a good life. This is my reference. Thank you so much.